My last question, I think my last, is will fluoridating the water cost us a lot of money? And I have a kind of a partial answer to that one. We are getting our statistics together so that we can tell you better, but the part that we're lacking is the information about the startup costs for fluoridating the water system. So, as you know, we have a water treatment plant up in Woodford, and depends on how much has to be done to that water treatment plant. Will there have to be an expansion in the size? We don't really know that. How much will the equipment cost? We don't really know that. What I do know is that to pay for the startup costs, we will be getting some money from the state, and also I think that we will be getting some money from other donors, although this has not been completely worked out at this point. So the startup costs are an unknown, but the annual costs we can make a pretty good estimate. Once you have all the equipment in place and are ready to roll, it's going to cost, every year it's going to cost a certain amount of money. And we've come up with estimates of about $16,000 per year. So I wanted to give you some statistics. $16,000 sounds like a lot, and you would not spend it if you didn't have to. But here's some statistics about the savings that you have if you drank and paid for fluoridated water for your whole life. That would cost less than one cavity at the dentist's office. Another statistic is that for every $1 invested in water fluoridation, you save about $18 in dental costs. You might say that we should just have fluoridation given to children in the schools. However, it turns out that school-based programs cost a lot more. So that's one set of statistics. It's inexpensive when you consider what you're preventing and the costs of treatment. The second point is that we're already paying a lot for dental care. We're paying this through our taxes. We have Medicaid dental allowances. We have emergency room visits, which are paid for by Medicaid, or perhaps not, in which the hospital has to eat the bill, so to speak. We have the Dr. Dinosaur program, which covers most kids in the state. We have Agency of Human Services waivers for pain and suffering, in which a person who has a dental abscess and needs to have a tooth extracted can have the state pay for that extraction. That's outside of the Medicaid system. The free clinic takes your contributions, your donations, and we fund a certain amount of dental care for our patients. The dentists themselves annually have had free dental days, and they see, on a Saturday, they see 70 or 80 patients from the community. So these are all costs that we're already paying, and it seems to me, without giving you exact figures, it seems to me that the cost of fluoridating the water system is a lot less than the cost of having to treat dental decay. But even more important than that is the human costs of not fluoridating. We have 140-something kids in the past year that went to the operating room because they had to have teeth extracted under anesthesia. That should not happen. We have, as Mary Lou said, in 2 of our schools we have greater than 50% of our kids in the kindergarten and 3rd grade have cavities. That's not good. Those kids are going to lose their teeth in years to come if something isn't done. They would have been, both sets of kids would have been a lot better off if they had had fluoride in their water system.